about your research topic here, and yeah. So I have Tasha here. She will help me play the video that you sent to us, and yeah, I think we'll play the video first, and then after that, the slides we can go back and forth when they're during question and answer. Is that correct? So
Right.
all right, okay. So I think you can start with further introduction of yourself to my students, and then after that, Tasha will play the video. The floor is
Yes,
yours, Kamada Sensei.
yes, great. Professor Maurida and Ritska, thank you very much for this opportunity. And it is my great pleasure to give a lecture today. To ensure a smooth session and avoid any technical or internet issues, so I prepared a pre-recorded lecture for the first part of today's class. But after the recording, I'll be here live to answer your questions. So I hope you enjoy the presentation. So, Tasha, could you please start the video?
Okay.
And I believe I included very short my self-introduction in the presentation.
That's fine. All right. Still loading.
Oh, and by the way, yes, my name is Masamitsu Kamada. I am an associate professor at the University of Tokyo, and I believe I said this too in the presentation.
All
Thank
right.
you, Dr. Kamada, for the introduction. Can you see my screen? And
No,
can you hear the
it's kind of,
sound? My computer?
yes, sound, but it's kind of, oh, yeah, yes, now I can see the screen. Thank you.
Sorry, still mute.
I think you might want to change the audio source of your laptop, Tasha. So on the audio.
Okay, it's okay now?
The
Try again.
topic of this video lecture is social marketing and network interventions applied to community-wide promotion of physical
There's
activity. Here are the learning objectives. Here are learning of this lecture. Our main goals are, first, to keep promotion through marketing and network intervention strategies within local governments, illustrated by specific examples in various regions and organizations. And before moving on to the main topic, allow me to provide a brief introduction of myself. My primary mission is to contribute to a world free of physical inactivity, aiming for a society where each person can live an active life that accommodates their individual needs and circumstances. So, throughout this lecture, I will present some real-world evidence and examples specifically related to physical activity. As an introduction, let's take a moment to think about the world we live in. Are people physically active enough in your country? Or do we face any challenges? When we look at physical activity surveillance data in Japan, national average daily steps has been declining in the past 20 years. And this is similar to the findings from global studies. The prevalence of insufficient physical activity has increased among men and women globally, including in East and Southeast Asian countries such as Indonesia. Although the prevalence of physical activity has decreased, studies are increasingly showing that physical activity is important for our health. World Health Organization and health agencies of many countries recommend physical activity, and it includes any bodily movement produced by skeletal muscles that results in energy expenditure. So we are not talking about only leisure time physical activity such as sports and exercise, but also other daily activities in household, occupation, and transport-related behaviors. And one of the key messages is some is good, more is better. And for example, our study shows the dose-response relationship between step counts and all-cause mortality. And we found that among older women, as few as approximately 4,000 steps per day was significantly related to lower mortality rates compared with lower steps. To develop effective population strategy, we need to know what influences our physical activity behavior, the determinants. Diverse factors influence physical activity at the individual, interpersonal, environmental, policy, and even global level. So multi-level and intersectoral approaches are necessary to change population-level physical activity. That's why health agencies recommend multi-strategic community-wide interventions to promote physical activity. However, a Cochrane review published in 2015 on community-wide interventions revealed that there were very few high-quality studies to examine its effectiveness, and such high-quality studies, including our first-ever cluster RCT, followed by 2 studies in the UK and 1 in the United States, failed to achieve population-level increases in physical activity. But most of the studies were based on short-term intervention with 1 year as the most frequent duration. It may take much longer to achieve population-level increase compared to individual-level interventions, and it was not clear how long is enough. So we extended our study, and in 2018, we published the results of our 5-year cluster RCT, which showed a population level increase in physical activity. This is the first whole-of-community randomized trial succeeded in population level physical activity improvement. The study location was Unna City, Shimane, which locates in the western part of Japan. The study design was a 5-year cluster randomized controlled trial. We randomly sampled 12 communities and randomly allocated 3 communities for the control group and 9 communities for the intervention group with stratification by population density. Then, intervention communities were randomly assigned to 3 subgroups
by different physical activity types promoted. In Group A, aerobic activity, mainly walking. In Group FM, flexibility and muscle strengthening activities. And in Group AFM, all of these three activities were promoted. The intervention was a 5-year multi-strategic committee-wide intervention delivered to all of the residents in the communities as a multidisciplinary project of Unna City local government. Evaluation participants were randomly sampled 6,000 residents aged 40 to 79 years. Self-administered questionnaire was used for evaluation, and the baseline response rate was 74%, and they were followed for 5 years as a representative cohort. Finally, about 3,000 residents responded to both baseline and the 5-year follow-up surveys. We analyzed about 4,000 samples in an intention to treat manner. Of note, here I'm not talking about individual level intervention, which gathers a limited number of people and brings them to a hospital or health facility for intensive exercise. Instead, we are focusing on community or population level intervention, which aims to increase the number of people engaging in physical activity across an entire city. So we require a more strategic approach to planning and implementing interventions. For the intervention, we took a social marketing process such as setting behavioral objective, segmentation, audience research, and identifying marketing mix, exchange, and competition. These are considered as 6 marketing benchmark criteria. Social marketing applies marketing principles from the business sector to drive various behavior changes. When we break down the steps, it looks like this. First, situation analysis and segmentation and selecting priority audiences, setting behavior objectives and goals, and developing marketing mix or 4P strategies, and creating messages and materials, and after pre-test, finally, implementing interventions and evaluation. This process yields benefits in outreach strategy, gaining audience insights by understanding their perception of exercise and their broader needs and wants in life, and establishing a focused approach for intervention. So next, I'll provide a brief explanation for some steps, although not covering all of them in detail. The first step, situation analysis, includes SWOT analysis. This is an acronym representing internal and external favorable and unfavorable factors respectively. For instance, an internal favorable factor is strength. Now consider where the COVID-19 pandemic fits into the project to promote physical activity. The pandemic can be considered as both opportunities and threats. Because the pandemic has reshaped our daily routines, and it poses a threat as decreased commuting-related physical activity due to remote work and restrictions on social activities have become prevalent. Conversely, it presented an opportunity as some individuals have incorporated home exercises into their shortened commute or adjusted schedules. By recognizing these dual dynamics, we can strategically design interventions that capitalize on newfound opportunities and address emerging challenges, obtaining valuable insights for our strategy. The next step is segmentation and selecting priority audiences. If we fail to identify our priority audience, interventions often end up as please-everyone approaches that don't resonate with anyone and become unclear. Conversely, once the priority audience is determined, the message becomes clearer. When persuading the public sector, which typically leans towards targeting everyone, to implement priority audience settings, it's essential to propose the implementation of periodization and long-term planning. This could involve initially focusing on one segment and then shifting the focus to another in the next phase. Also, I would like to introduce a method for targeting or selecting priority audiences. The TAR-PAIR model assists health promotion practitioners in systematically comparing and selecting appropriate target groups when faced with a number of segments competing for attention and resources. It is an acronym representing 6 criteria for determining the priority value for each population segment. T for the total number in the segment, AR for the proportion of at-risk persons in the segment, P for persuasibility, A for accessibility or how easy it is to reach the segment, R for additional resources required to meet the needs of the target audience, and finally, E for the equity factor and the inclusion of social justice considerations. Each segment's overall score is calculated by the weighted sum of its score on each of these attributes. It's rare to have quantitative data for all these attributes, and the weighting is always based on the value judgment of the implementing entity, and that's perfectly acceptable. The key here is that we can systematically assess segment priority by utilizing these viewpoints and others. In social marketing, the identification of the marketing mix, known as the 4 Ps, product, price, place, and promotion, plays a crucial role in designing effective strategies. Let's apply these to the promotion of physical activity. In terms of product, our product is the behavior itself, physical activity, but it's not just about exercise. It's about the bundle of benefits it brings. For our project targeting older women experiencing low back or knee pain, the benefits of physical activity include feeling good, alleviating pain, and preserving social bonds. We position physical activity as a method for relieving musculoskeletal pain, competing with alternatives like inactive rest, supplements, and hot or cold compresses. For price, what does it cost individuals to engage in physical activity? There's the time required, and the fear of pain worsening. To address this, we provide information on quick and effective methods of physical activity. On the other hand, we highlight the monetary cost and anxiety about the effectiveness of competitors. We use information strategically to increase the perceived cost of competitors and emphasize uncertainties in their effectiveness. For place, the ideal locations for obtaining information about and engaging in physical activity are everywhere our target audience is. Home, town streets, and community centers serve as platforms for visual information through flyers and posters. Local audio broadcasts disseminate audio information. Personal encouragement is strategically placed at medical checks, community events, and through family and friends, creating a supportive environment. Finally, for promotion, to influence change and create demand, we employ various strategies. Printed materials such as flyers and posters are distributed widely. Advertising includes banners and local audio broadcasts reaching a broad audience. Public relations efforts involve articles in community newsletters, enhancing awareness. Personal encouragement becomes a key component, delivered at medical checks, community events, and overall enhancement of social support. Addressing the 4 Ps allows us to design interventions considering the needs and wants of our target audience. We aim to minimize perceived costs, maximize accessibility, and foster a supportive environment. And once you create messages and materials based on the 4 Ps strategies, the next step is the pre-test. This is a vital phase before launching the intervention. It involves sharing draft materials with a small representative audience to gather feedback. This step helps identify and address issues, ensuring the intervention's effectiveness by refining messages, visuals, and strategies based on audience reactions. The pretest is a cost-effective way to enhance the overall impact and success of a social marketing initiative before reaching a broader audience. In our project, following the marketing process, the basic components of the intervention were information, education, and support delivery throughout the intervention period. Among these components, local mass media and mass encouragement by health professionals were emphasized in the first year. This approach was successful in increasing awareness and knowledge of the residents. Then in Phase 2, network intervention or word-of-mouth buzz marketing was emphasized in order to change actual behavior, physical activity. And finally, Phase 3 placed a balanced emphasis on all of 3 components by leveraging the resources cultivated during the previous phases. As a network intervention, we took the following steps. First, the intervention staff detected key influencers within each community, then motivated and collaborated with these influencers, and finally, the intervention staff assisted those community partners to disseminate physical activity and campaign messages to their neighbors and families. So, how can we identify opinion leaders to promote behavior change? Here is a list of methods to help identify opinion leaders. From these, we used a mix of 4 methods. Firstly, self-selection involves volunteers stepping up through solicitation. Staff selection, leaders were chosen through community observation, and the positional approach identifies leaders in roles like clergy, elected officials, media, and business elites. And lastly, in snowball method, index cases provide nominations of leaders who are then interviewed until no new leaders are identified. There is no single best method. Instead, we need to try our own approach based on the objectives, availability, and situations. Additionally, it is suggested that 3 key personality types contribute to the spread of behaviors: the salesperson, the maven, and the connector. A salesperson persuades, a maven accumulates knowledge, and the connector excels at building social networks. These identified influencers were invited to become community lead partners. In our project, the Research Institute within the city's Health and Welfare Department served as the headquarters, where I also served as a researcher at that time. The project was carried out in collaboration with local self-administered organizations, various activity groups, and organizations in each community area, as well as other departments within the local government. So, before implementing the interventions, there was a crucial phase for building relationships and networking with organizations. Here are the results of our project. As the primary outcome, adults achieving recommended levels of physical activity increased in intervention communities compared with control communities. In addition, subgroup analysis showed the intervention was effective for promoting all types of recommended physical activities, which are walking, flexibility, and muscle strengthening activities in the targeted communities, respectively. However, a bundled approach which attempted to promote all forms of physical activities simultaneously was not effective. We did not observe significant effect in any type of physical activities. That suggests we may need to promote one thing at a time in a large-scale intervention, especially when resources are limited. For evaluating the impact of public health interventions, the model provides a valuable framework. REAIM stands for Reach, Effectiveness, Adoption, Implementation, and Maintenance. In our project, we achieved 100% adoption, with all committees embracing the intervention. Regarding implementation, there was no clear difference in intervention dose among communities. In terms of reach, The campaign's awareness among residents was 79%, and quasi-population coverage of educational activities exceeded 100% based on the total number of participants, although this may include some individuals counted more than once. For effectiveness, the primary outcome of increased physical activity was observed at the population level. And finally, in terms of maintenance, self-organized activities continued in all communities even after the 5-year study period. While not every project requires a rigorous evaluation design like a cluster randomized controlled trial, every project does benefit from an appropriate impact evaluation. Again, this is the first whole-of-community randomized trial succeeded in increasing the population level of physical activity. The paper received the highest ratings for both the quality of social marketing and the research for its low risk of bias, and it has been cited as evidence in the US government guidelines and academic statements. Now the project is moving to a whole-of-city dissemination and implementation in other cities. So, what are the keys for successful promotion programs? They may include high community engagement, state-of-the-art social marketing, an interdisciplinary collaboration, and a financially stable headquarters, since this is a long-term business. The keys need to be investigated in the future. So it's very tough, but not impossible to promote physical activity at the population level. We just need sophisticated approaches. Okay, so our community-wide intervention was effective, and it has been led by local government. Although it is a multidisciplinary effort including private sector, I was always thinking about the possibility of other approaches from private sector or business side. One example of public-private partnership is with the professional sports business. We started a league work project with the Japanese Professional Baseball League. Baseball is one of the most popular sports in Japan. The league released a free smartphone step counting app with some gamification features, including competitions between opposing teams' fans based on daily total steps on actual baseball game days. For example, if there is a baseball game between Fighters and Hawks tonight, both teams' fans also compete by the sums of their steps. The app can be used anywhere, and it has been downloaded over 70,000 times so far. Previous studies showed smartphones were moderately accurate for tracking step counts. We evaluated the effect of the app by using de-identified data. These are the histograms of daily steps in about 15,000 users. Days achieving 10,000 steps increased from 24.4% to 27.5% after the introduction of Player's photo collection feature on October 2016. This is a reward system for 10,000 steps achieved. We can see clear bunching around 10,000 steps, suggesting some of the app users began aiming at this level, responding to the new reward system. According to quasi-experimental evaluation, the daily average steps for the app users increased after the app installation, and the increase maintained for about 9 months. The users included a wide range of age from both sexes and diverse socio-economic background, and there was no significant effect modification by sex, income, and education level. Also, a quarter of the users were in pre-contemplation stage of exercise behavior change. This means the app succeeded in reaching those who did not intend to start exercising in the near future. They are thought to be underrepresented in traditional health programs. Okay, so it seems sports fandom can be used as a key insight for behavior change. But there are some caveats here. In general, by definition, there is a gap between watching sports and doing sports. For example, in our study published in the Lancet Physical Activity series, to coincide with the opening of the Tokyo Olympic Games in 2021, we looked at population physical activity or sport participation data in the hosting countries of the past Olympic Games, and we found little change in the prevalence of physical activity or sport participation before and after the Olympic Games. So, when we want to connect different behaviors and use some insights, including sports fandom, to promote physical activity, strategic planning and implementation are needed. How to support people in the pre-contemplation stage, those who are not considering changing their behavior in the near future, is an important question. As one of necessary multi-level and intersectoral approaches, an insight-based nudge, like establishing a system that links baseball or music idols with physical activity, may make the target behavior more appealing. Interestingly, our Parig Walk app doesn't explicitly mention health or exercise, yet people ended up walking more after installing the app. So the key is to discover insights of your target audience first, and collaborations can provide additional leverage to attract them. Okay, so let's recap the key takeaways. Social marketing and network intervention strategies are effective tools for promoting health behaviors. Remember, interventions can be refined through a deep understanding of target insights and a step-by-step development process. Lastly, the importance of cultivating relationships and collaborations has been emphasized, offering us the strengths to implement comprehensive and innovative approaches. So, as you move forward, keep these key points in mind and consider how they can enhance your work in promoting health behaviors. I thank all of my collaborators and funders of the study. If you have any questions, I would be happy to answer them. Thank you for your attention.
All right, thank you.
Okay, thank you very much. Any questions from the students? It might be something new for most of you, but I would really encourage for you to ask. Oh, there you go. Nazwa, you can ask your question. Go ahead.
Okay. I was want to thank you to professor or the presentation was really amazing. It's the question should be like complicated, but I want to ask this like considering the latest WHO data shows global inactivity is projected to reach 35% by 2030. How we can realistically achieve SDG target 3.4, despite like 92% of countries having policy, a massive implementation gap remains. And looking at the 4Ps framework to the urbanization paradox in Jakarta, there is like clearly massive friction in the place and price component, with 37.4% of Indonesia's being inactive and Jakarta's step counts being among the lowest globally. And the price of movement due to heat and air quality is too high, while the place and like walkable infrastructure is too limited. And plus, given the inactivity arrived at 10% increase ischemic deaths here, do you believe global health indicators should shift from measuring disease prevalence to aggressively tracking informal barriers? Should we mandate like metrics for place, like TOD and walkability score to reduce the price of movement? Or is the global implementation gap proof that we are over relying on promotion while ignoring the infrastructure but into our environment? So my question is like, should we just shift that thing, or we just over relying on promotion? Can you understand what my question is?
So actually, I thank you very much for your question, and I believe I could understand the first half, but I couldn't understand the latter half and your kind of the point of question. So could you speak slowly for the
Okay.
latter half, especially your question?
Okay. So my question is like, do you believe global health indicators should shift from measuring disease prevalences to aggressively tracking environmental barriers? Should we mandate metrics for place like TOD and walkability score to reduce the price of movement? Or is the global implementation gap proof that we are over relying on promotion while ignoring the infrastructure built into our environment?
Oh, I see. So maybe but by the way, what TOD means? I'm sorry, I'm not.
Transport-oriented development.
Excuse me, sorry.
It's transport-oriented development.
I see. So what does it mean?
So I think it means that the area should be
Yes.
supported by proper transportation to encourage the use of public transportation, something like that.
I see. Okay, thank you. And I think so first the key things and is multi-strategic approaches and systems approaches, including the environment and also the promotion through information and education, and all of them are necessary. And I don't think the WHO and other international agencies do not necessarily put emphasis only on the promotion or information or education side, but also the environment is necessary and important factor for promoting physical activity and also other health behaviors. And And one point maybe is how can we kind of mandate to any agencies or government? And it's a very different question, and how we can um, achieve and find that very narrow policy window to implement those strong implementation. And did I answer your question?
Yes, thank you for your information, but maybe just like wanna like point out your answer, like so we're not relying on promotion, right? Or just we have to, like in Jakarta, for example, like we have to build more infrastructure in Indonesia, because like if we
Yes,
just like have like intervention on behavioral, it's like not to like to what I can say, like Indonesian people is not like Japanese people, because it's like to overheat is here, like
yes.
maybe yeah. Okay.
Yes, and actually, and I know every place has specific kind of barriers for doing physical activity, and for example, when we have to implement some programs and also policy in Indonesia. So first, we need to identify what can be a barrier and also facilitator or promoter of such behavior. And I think there can be some chance or opportunity in in some way. And for now, I do not have any specific answer for the solution in Indonesia. But what I have to do when I want to contribute to the policy and programs in Indonesia is to hear and see the life of people in Indonesia. And what I know is the professionals, and I believe that includes professionals in Indonesia, do not necessarily grasp the real life or the core insight of the target population. And that's always I talk in Japanese government public health nurses and other officials to first grasp the real and core insight of the target behavior among the residents first, and that cannot be understood without the deep and sometimes the time-consuming interviews and some audit surveys within the communities. And yes, and that's kind of time-consuming process, but I think that is necessary.
I just want to add a little bit for
Yes.
more answer. It's very true that some of the people who made the policies in Indonesia, they don't understand how the people who actually use the public transportation or use the infrastructure feel and use it every day. So sometimes they make slightly sloppy policies. I think it's quite similar But I think in Japan they're really good with understanding the situation. But in here we need a lot more improvement in that area. So yeah, what you said was very true. All right.
Yes.
Yeah. Anyway, we have only 4 more minutes. So if there is one quick question, you may ask your question. Oh yes, Zulfi, go ahead. Just a quick question, all right?
Okay, thank you, Bu Rizka, dan thank you, Mr. Kamada, for presentation. I really enjoyed your paper on fandom-based gamification for increasing physical activity. And in Indonesia, football fandom is extremely strong and emotionally driven, especially among supporters of clubs like Persija Jakarta and Persib Bandung. This strong social identity might make a similar intervention very engaging. But however, Indonesian football fandom is also associated with intense rivalries and occasional conflict between supporter groups. Um, I really want to know, in your opinion, could a fandom-based gamification approach still be effective in such context, which is high level of rivalries and high chance of conflicts? And what design strategies would you recommend to ensure the intervention promotes healthy competition without reinforcing negative rivalry? Thank you.
Yes, thank you very much. And yeah, that is very important point, I think, and that can happen even in Japan and other countries. And so I think the key point is also again the understanding the target population first, and maybe think with the target audience is very important, not only among professionals, but with the target audiences or target population is very important, and what kind of measures are needed in the program to avoid such kind of boomerang effect or side effect and unfavorable effect. And I think that is a key, I think, yes. And thank you very much for the great important point.
Right, thank you very much. So I think the bottom line from the previous question and the question earlier is that understanding the population first and then creating the promotion, the program promotion or the activity. Is that right?
Yes, yeah.
All right. So unfortunately, we have limited time today. I'm very aware that you're only available until 1 minute from now. So if my students have more questions, can they contact you by email?
Yes, but so if Rizka, you can kind of gather
Compile.
them first. Yeah, to email and please
Send it to
send
you.
from
All right.
you is much
All right.
more
Easier.
convenient for
All
me.
right. No worries. So yes, if you have more questions, you can send the questions to me, and I will forward the question to Dr. Kamada, and then I will send back the answers to you. So thank you very much for your time, and I hope we have another opportunity to invite you to Indonesia. And
Yeah.
yes, have a good day. So you may leave the Zoom first, or you have something to say before you leave.
Oh no, thank you very much, everyone. And I also want to know what is necessary and what should we do in Indonesia. That's very, very important. And so, thank you very much. And I'm looking forward to your feedback and comments. Thank you very much.
All right, thank you very much. Bye-bye.
Bye.
All right, you may leave the Zoom first. All right. So, jangan lupa ada kuis, tapi saya harus keluar duluan. Jadi Tasya minta tolong diatur ya kuisnya. Saya leave duluan ya. Terima kasih banyak. Selamat siang.
Terima kasih Bu, selamat siang. Baik teman-teman, untuk kuis bisa tetap stay di Zoom ya, karena akan ada passwordnya. Oke, jadi untuk passwordnya ya social marketing. Silakan teman-teman bisa diakses kuisnya di kuis kuliah umum 2. Jika nanti sudah selesai mengerjakan kuis, silahkan boleh langsung leave Zoom-nya.